Camden Clinical Commissioning Group, or CCG, buy healthcare services on behalf of the people in Camden. We are working to integrate services around the needs of people in Camden and are focused on improving the outcomes that people care about the most. Camden CCG is changing the way we invest in services to achieve these aims. We call this value-based commissioning. This means changing how healthcare is organised and funded in order to get the most value out of services. In a value-based commissioning system, services are designed for a population with similar needs. This may be a specific condition, shared demographics such as age, shared geography, or a combination of these. When the population group has been identified, outcomes that are important to them will be defined. These will be measured over the course of the contract. In our current system, we measure and pay for processes. For example, each time someone attends an outpatient appointment. In value-based commissioning, we measure and pay for outcomes. These are the results people care about most when seeking treatment, including being able to live the lives they want. In our current system, services are organised and funded separately, which can make integrated care more difficult to achieve. In value-based commissioning, services are organised around people with similar sets of needs. These services will be funded through a single contract. This encourages collaborative working, as service providers have shared incentives to improve outcomes for the population. Over time, people tend to access different services to help them manage their condition. In our current system, service providers only decide how to spend the funding that is allocated to their individual services. In value-based commissioning, a contract is awarded to a group of providers who are given an agreed sum of money to provide care for a population of patients over a particular time period. They can then determine the best way to invest this to have the biggest impact on patient outcomes and achieve value for money. For example, in the care of people with diabetes, a contract will be awarded to one organisation that is responsible for working with other healthcare providers to coordinate care for people who have diabetes in Camden. This gives the opportunity and incentive for diabetes experts to determine the best way of intervening early to prevent more costly care for patients later. For example, they may choose to invest in more community nursing support, which prevents patients from going to hospital unnecessarily. By delivering care in this way, people with diabetes in Camden will have better outcomes and money will be spent more effectively. This will deliver increased value for the whole population of Camden